So, what are some of the steps to start a gluten and casein-free diet for an autistic child? And is it better to start them at a younger age?
That's what a lot of the websites say. Because the younger the better for a lot of different reasons. Their taste buds haven't fully developed. They haven't had a chance to, have Doritos and find out that that's the only food they want to eat for the rest of their life.
Mm-hmm.
If that happens, autistic kids do have some. Will have food preferences. And the Dorito example, I worked with a child. That's all he ate for breakfast, lunch, and dinner was Doritos all day long. If you took it away, he would starve. He would not eat.
Oh,
So
wow.
if his mom was to try to switch to a gluten casein-free diet, diapers probably would have gotten involved because this kid would have
Yeah, he would have starved
kind of a
himself.
thing. So the younger the better for lots of different reasons. If it's all that they know, that's great. The family that had the restaurant, they had another daughter after the first one. She's only been raised that way.
Oh, they must be so healthy, those kids.
They are. They have a little bit of trouble in public. You go to the bank and they might give you a piece of chocolate.
Yeah. Wow.
But they try really hard. And the younger the better with just about anything. With most interventions for autism, if you can get the interventions in and you can start seeing progress before age 5, especially if they have expressive language before age 5, prognosis is much better.
Okay. Yeah, so I've been seeing a pattern with this. I actually was able to interview a pharmacist, but he wasn't able to give me half as much of the information that you've been giving me. He's basically said that if you're consistent with behavioral therapy, it really shows a difference in an autistic child's behavior. Now, what exactly, do you do with your patients? Do you do activities?
I do a combination. So traditional behavior therapy, what they're talking about is ABA, or Applied Behavior Analysis. That's an educational approach. So that's going to be done in schools. I used to be in early intervention, and I'm trained in ABA, and I've done that. But ABA really only teaches you behavior. So it teaches you sit down, stand up, things like if I say hello, you say hello. If I say how are you, you say I'm fine.
Oh, okay.
But the problem with that is that many of these kids learn rote skills. They learn to parrot. So, for example, I had a little boy I was working with when I worked at an autism center. He fell getting off the van on a big rock. It went through his leg, and he was bleeding profusely, needed stitches. And one of the teachers ran up and was like, Johnny, how are you? And he said, I'm fine. And he was crying, and there's blood all over the place, because he knew that that's what I say in response to those words, but he didn't fully comprehend what he was saying.
That's so interesting.
So there are other layers to it. Once you get past a certain point, when those foundational skills are learned, that's what ABA is really good for, those foundational basic skills. But when you start getting into the social aspects of autism, the social communication, the peer interaction, and all of that kind of stuff, you need to do more of a relationally based program.
Okay, and that's where you come into play, or?
I do relational based, but I also do a lot of, I do something that's newer in the field, which is called MIDD work, which is mental illness, developmental disability work with children. So my kids have a comorbid diagnosis of bipolar, depression, anxiety.
Okay.
Any other DSM access one diagnosis.
Mm-hmm.
And I work with them not just on social skills. I run social skill groups, but I also work with them on those other issues that they have.
Okay.
I do a mixture. I do school advocacy. I do cognitive behavioral therapy. I do play therapy.
Oh, wow, that's really interesting. So, do you think that the foods that we eat have anything to do with the reason why, there are so many of today's children being born with autism spectrum?
I think it's going to end up being a multitude of reasons why the increase is coming. Diagnostics are better. I will say that it's overdiagnosed and it's misdiagnosed a lot.
Oh, really? That's interesting because see, I think that ADHD is very like overdiagnosed and misdiagnosed, but I would never think autism.
Autism is any time a kid comes in with any kind of sensory problem, they're diagnosed autism. They don't make appropriate eye contact, autism. They can
Okay.
be shy.
Uh-huh.
So when I worked in early intervention, which is the 0 to 3 population in Hudson County. Hudson County has one of the highest prevalence rates in the state of New Jersey, and New Jersey has the highest prevalence rate in the world.
Uh-huh.
70% of the kids aged 0 to 3 were misdiagnosed.
Wow. And that's in Hudson County alone?
That was a subsection of Hudson County. So it wasn't the entire county. It was just the subsection that my organization works with.
Okay. Wow, that's still a lot.
It is.
Mm-hmm.
There's a lot of other diagnoses that can mimic autism, like reactive attachment disorder, other developmental delays, any of the anxiety disorders, abuse. There's just so much that can also look like autism in a young child.
Okay.
So I think that's part of it. I do think environmental factors are part of it. We're also seeing an increase in cancer. I think it's kind of linked in some way. It's genetic. So people who were not diagnosed 20 years ago now are having children. So that there is a strong genetic component. So it's multifaceted, I think. It's one of those things where there's not one reason.
Okay. And then of course like fetal alcohol syndrome and stuff like that during pregnancy, that also causes it, right?
No, not necessarily.
Oh, okay.
Kids who have SAS kids who have SAS don't have autism always. It's the same. It's the prevalence rate of a comorbidity of SAS and autism is very similar to the comorbidity within the general, not comorbidity, but the prevalence within the general population. So, but there probably are going to be some in utero factors that are happening as well. Medications, a lot of pregnant women are on psychopharmaceutical medications. We don't know the effects on the fetuses yet.
Mm-hmm.
Yeah, there's so much that can happen. And I think there's going to be hundreds of sub-classifications of it.
Okay. I know, like, I feel like they've already developed so many, like you just said, like, subcategories of autism, like the Asperger's, which is a milder version, and, like, stuff like that.
Yes. Right now, there's only 5 types of pervasive developmental disorders. There's Asperger's, there's classic autism, there's Rett, there is PDD-NOS, and then there's childhood disintegrative disorder. With the new DSM, they have 2 more that they're going to be they're proposing, and that's a semantic pragmatic language disorder and a nonverbal language disorder, nonverbal learning disorder.
And that will be classified under autism?
Well, right now, they're under pervasive developmental disorders, but because in layman's terms, people use the word autism for all of them, they're considering changing it to the classification being autism spectrum disorders, with PDD being a subtype instead of the classification.
Okay.
So, DSM-5 is not out yet. It's been coming out for the past 10 years. We don't know what it's going to look like when it comes out. But so right now there's really only the 5 classic types and then the 2 that are becoming more acceptable as well. But eventually we're going to have food allergy subtypes. I think we're going to have a lot of what I hear a lot of parents saying that their child was fine until they were about 18 months old, and then they had a high fever of over 104, and once the fever broke, they were autistic.
Wow.
That's going to be a subtype.
Oh, okay.
But none of that, that's still all in the evidence collecting phase. So.
Okay. And then I have one last question for you.